Good afternoon to everybody and those who will see this recording in the future. Welcome to the first ERN RITA patient-centered webinar series. I'm Jordi Anton, pediatric rheumatologist at Hospital Sant Joan de Déu in Barcelona, Spain. We will host this session together with Malena Vetterli, patient representative from RIPAG, also from the ERN RITA. The story of this webinar series comes back to several months ago when ERN RITA established the network with the more from branches. We will know more about this with the two speakers we will have today, Nico Wulffraat, coordinator of the ERN RITA, and Alessandra Magnani, vice coordinator. But in the last General Assembly in Utrecht, one of the requests in the Education Committee is to have a dedicated webinar series for patients and families. This is in the DNA of the ERNs, not only in ours, in ERN RITA, dedicated to rare immunological diseases, but in the other ERN RITA, all the other European reference networks according to the European guidelines. It's for this reason that we, during the General Assembly, asked those present if they thought that it would be interesting to have a separate webinar series for patients, because we have already especially lunch with RITA webinars every Tuesday, and there was more than 80% of people who answered the survey that said that yes, they wanted a separate webinar series dedicated for patients and built by patients for them. So we have been working on that since then. I would like to thank Colleen, who is a manager of our ERN RITA, and also Dr. Sabino Sasha, who helped, and all of the patient representatives that have helped us to work on drafting a program for the next months. This is the first webinar, and this will be like an introduction where we present which is the goals of RITA, how we work, and how we want to get the inputs of all the patients and their representatives. We want this to be a vital resource for information, support, and networking within the ERN RITA community. And moreover, we will build a video library with trusted and valuable information for patients that will be easily and free accessible through our websites. Overall, we aim to enhance patient education and empowerment, improve patient-caregiver interaction, and increase awareness of rare diseases, especially rare immunological diseases that are represented in our 4 branches: pediatric immunodeficiencies, autoinflammatory diseases, pediatric rheumatic diseases, and vasculitis and rare and autoimmune CNS diseases. We want to use these webinars also to give voice for patients. So you will see that always will be chaired by patients and led by them. And the topics proposed has been discussed with all of them. We want to use them as transversal as possible so they can give answer to all those different patients and families with rare immunological disease. Our idea is to have one every 3rd Wednesday of each month between 6 and 7 p.m. Central European time. We know it's difficult for patients sometimes to adjust, but the advantage of new technologies is that these webinars will be recorded and you can check them in another time slots. We have prepared a program that we think is challenging and interesting for all of you. We will go through topics like transitioning from childhood to adulthood, with recommendations that have already done by primary immunodeficiencies group for transitioners in PID. We will talk about genetic counseling for patients with rare immunological disorders and management of high-risk pregnancy. We want to talk also about the rights as a person with a rare disease and the support at the European or national levels, or the patient's perspectives in advocacy of rare immunological diseases. We will talk also about risk of infection and immunological rare diseases, or if adherence to therapy will be also another topic. So you see, it's challenging and ambitious, and moreover, we want this to be like a first start for the first year, but we will welcome any suggestion from patients, from associations to draft new months and next program for upcoming year. We have today a presentation from the structure of our ERN RITA and also the patient's view that Malena will present. And we encourage you to ask the questions that you have, to interact through the chat channel, and to share all your questions that you have. What is important for us is that be as much accessible as possible. This is the reason that please, all of you that are involved in different patient association, extend the voice, extend the word, and let everybody that we will meet every Wednesday from 6 to 7 here in the Patient Center ERN RITA patients webinar. Malena, if you want to introduce our first presentators.
Yes, well, we have two panelists basically. Nico Wulffraat, he's the coordinator, the current coordinator of ERN RITA, and Alessandra Magnani, she's gonna take over from Nico in a couple of months. So if you can start, Nico. Thank you.
For sure. I thank you for your introduction, which is almost completely right. Okay. Because indeed, I am the coordinator. I will step down soon, and I will be succeeded by Joost Swart. And since the RITA is expanding so much, we thought it was wise to expand the activities of the coordinating team and also introduce a vice coordinator, and that is going to be Alessandra Magnani. We thought for this excellent format, which was explained now just a minute ago, that it would be good to explain what is ERN, what is RITA, how is the structure, because I can imagine for academic doctors like me, it's simple, and most of big grants are organized like this, but it could very well be that for patients it's not so clear. That's why we wanted to organize it, to structure our talks. It will be a duo presentation by Alessandra and me. I am in RITA since 6 years, since the beginning, so to say. First as the stream lead for rheumatology, and the past 4 years I have been a coordinator. What is important about ERN's European reference networks? They're not really scientific bodies, because the aim is to improve the care for patients with rare disorders. That is the main thing. And so all the activities, you can ask yourself, how does this serve the care for patients? And that's why we value your input so much. As this format, patient-led and patient-derived topics for webinars every third Wednesday is excellent. So one of the stakeholders, most important stakeholders, you can say, that's you, that's the patients. But we have to deal with other stakeholders too. You have to realize that this care, this newly formed networks, there are 24 for 24 different disease areas. This is all initiated by the European Union. And they provide us with budgets to organize this. So that means that for us, we have to account, we have to discuss activities with the European Commission, DG Health, and the board of the member states, because this is very important. Also, the national health authorities are involved here because they must agree. And also, we should align the opinions of the various healthcare authorities. So, and it's not only that, we have to collaborate with the other 23 ERNs to avoid overlap or to stimulate overlap, or in fact to discuss collaboration and the methods in which we work. And then also important is we all originate from scientific societies, as we have ISAID, as we have UVAS, as we have PRESS, and that's very important because these activities should be streamlined and not be in competition with each other. I already mentioned the patient organizations. Maybe next screen, there we are. This is, no, previous screen, please. Number 2. Yeah. Here you see on the website the main thematic areas. This is very doctor driven, I must confess. This is how doctors, immunological doctors, which that's what we are, that's how we divide into main thematic areas: primary immune deficiencies, autoinflammatory diseases, vasculitis, pediatric rheumatology. And that's the current situation as it is now in textbooks and in meetings. Next slide, please, Colleen. This is how the distribution of centers from the RITA network is distributed over Europe. Of course, it's a challenge for us to involve as many EU member states as possible, and also in the south and in the east of Europe to increase the number of sites that are admitted as a healthcare professional, and thus can refine the network as it currently is. The centers, as you see them in green dots, some of them are have an expert status for all 4 disease areas. Some are focusing just on primary immune deficiencies or pediatric rheumatology. This is how the current situation is, and this is what they applied for and were evaluated for by the European Union. And these centers are now all fully acknowledged. Next slide. Okay, here you see just the names of the coordination team. It's mainly based in Utrecht, the Netherlands, where we have project managers and myself, but also we have the team in Barcelona, Alessandra Magnani. I'll hand over the mic in a second, and we have the team in Prague. They help us with the CPMS help desk. We'll explain in a second what that is, and you see the names of the teams listed below. Next slide. And now I hand over the mic to Alessandra.
Thank you. Thank you very much, Nico. Thank you also for this very clear presentation of the ERN RITA. So in these few slides, I will present you the governance of the ERN RITA. So as Nico already mentioned very clearly, the board of the coordination team actually of the ERN RITA is based mainly in Utrecht. As we maybe Colleen, if you can be back to the previous slide, please, so I can better the previous one. Thanks. Okay, perfect. So this is the slide that we just saw with the coordination team composed by Nico, who is the current ERN RITA coordinator, and Joost Swart, who is taking over in these months. They are pediatric rheumatologists, very experienced and based in the University Medical Center in Utrecht, and I am based in Barcelona in the pediatric hospital San Juan de Déu, and I joined the RITA board very recently. Last year I was actually co-chair of the research working group in ERN RITA, and at the end of the year, Nico and the board kindly invited me to be part of the board as vice coordinator, mainly with the idea of helping in the interactions among the different streams and patient association, etc. Because as we will see in a while, the board is composed of all these different representatives. And very importantly, the coordination team in Utrecht is also composed of 3 project managers, so Bart, Colleen, and Yasmin. And as Nico mentioned, there is the IT team RITA based in Prague, who is helping in the coordination of the CPMS help desk, offer codes, web development, and it is coordinated by Pavla. So we can switch to the, thank you, Colleen. So actually ERN RITA has this peculiarity that Nico already explained, of including different streams, so different branches that are the branches of autoimmunity, primary deficiencies, pediatric rheumatology, and autoinflammatory diseases. And this is a peculiarity of ERN RITA that I really would like to highlight, because actually ERN RITA is the only organization in Europe combining all these different streams, different branches, and so allowing all the scientists, pediatric patient associations, researchers, allowing all these different people talking together and interacting. And so my role within RITA will be to help further in this interaction. Actually, I'm a pediatric immunologist, and I initiated my residency as a pediatric rheumatology. So that's when years ago I met Nico and Joost and Jordi the first times. And then I switched progressively to the field of primary immunodeficiencies, and where I'm working now, and mainly in cell and gene therapy development. So in the RITA board includes the 4 stream leads who represent the different branches of ERN RITA. So we have Mark Little from Ireland for the autoimmunity branch, Michael Albert from Germany for the primary immunodeficiencies, Karin Wouters from Belgium for the pediatric rheumatology stream, and finally Marco Gattono from Italy for the autoinflammatory diseases branch. And but the board also includes, very importantly, thank you, Colleen, the boards include very importantly the patients, patient organization, their patient representatives. And actually, so the patients participate to the board are involved directly in the board through two different ways. One way is through the RIPAG, so the RITA Patient Advocacy Group. I will not enter into details because Malena will explain it very well in a while, but also through independently through patient associations like the ENCA, which is the global network for children with arthritis and autoinflammatory conditions, and finally the IPOP, which is the organization and the leading advocate for primary immunodeficiencies patients worldwide. So I will I think that Nico will take over again to enter into more details on which are more in details the activities in ERN RITA that involves directly the patients.
Yeah, well, thank you. This is just to mention some of the activities which are relevant for patients, and we wanted just to highlight them, to explain why we feel these activities are important. CPMS is really a new tool, and of course it's about second opinion to discuss difficult cases. Often you know your colleagues in your country or in another country, and you from time to time you can call them and consult them and ask them their opinion. But this is structured in a very precise way, very detailed format of presenting a clinical case, including X-rays, MRI, CT, lab tests, in a very structured way. And also these data are they're anonymous, of course, but these data are being reviewed by a large group of experts from the European member states, RITA experts. And by doing this, and having a discussion, we give an advice to the local referring doctor so that he may do additional tests or try additional therapies. We think that is very important, and also we have seen so far that it will increase the participation between centers, because you get to know each other more. You're getting more international contacts. Likewise, it will induce new contacts with the scientific societies. The scientific societies also provide us with new members of experts that help us discussing difficult cases, and also participate in research projects. So it's difficult for doctors because it costs a lot of time. We have to find the right moment to discuss, to find each other, but we feel it's very valuable for patients. My impression so far is that most patients value this greatly, that their cases are being discussed by many doctors throughout Europe. So that's very important. Another topic is the clinical practice guidelines and care pathways. We have the ambition that every doctor in every patient in Europe is entitled to optimal care. And then what is optimal care? There are quite some differences throughout the European Union, and we wanted to visualize these. So in order to discuss them and maybe come to a final joint proposal of how diagnostics and therapy should be done. And then if there is such a proposal, it should be evaluated also. And for that, we want to use the clinical care pathway. It's very new, and we do need patients for all these activities to participate in these projects. And these projects are being governed again by Alessandra. So if you have ideas, suggestions, please contact her, and she will discuss this further with the stream leads and other working group members. Another important activity is the registry. That's not directly linked to patient activities, but it is important to know where are the patients, what doctor is taking care of them, so that if there are new questions, we can discuss this with a whole group of patients with the same rare disease. And that's what is being registered into RITA registry. So it does not contain many clinical data, but it just contains the information on where is the patient and what is the diagnosis. So if there is a scientific or a practical therapeutic question, we can easily retrieve where the patients are. Education is the key, as we now are witnessing. So this is very important, and I'm happy with this input from the patients in the topics. Patient journeys serve, of course, an educational purpose. It's very clear. Also, the European Commission stimulates the writing of a patient journey. And Malena will further give detailed information on this. Next screen, please. So this is just to give some examples on how patient participation works in practice, in the RITA activities and other projects. In fact, as you have seen, there are 4 main streams with medical leads, and every medical lead has a patient organization, a person from a patient organization to as a team and discuss the topics that are at hand. Even they are not they are in the lead in certain projects. For instance, the patient journeys. What does a patient experience during the phase that there is no diagnosis yet, and there are diagnostic evaluations, and also therapy when there is a presumed diagnosis. For another topic is, for instance, newborn screening, which is being put on the map by a very active group, IPOPI, and this is going to be a big European project where all the EU member states will collaborate. And then this is number 3, and that is a project funded by the European Joint Program for Rare Diseases, and this is called the PAVE project, where most of the partners collaborate and all work on topics to increase patient the quality, experienced quality of life, and also studying items that were put down by the patient's organization to receive more attention. For instance, the Buddy project, as it is being set up by our Israeli partners. Next screen, please. This is then the last one. I hand over back the microphone to Jordi and Malena.
Thank you very much, Nico. I mean, I think you summarized very well. And it's, as I said at the beginning, it's an ambitious program, but with a lot of already success. I mean, there have several patients that have been benefit of this CPMS. There's a lot of training that has been done in the webinars, and yes, this is the most visual and accessible. But behind all of this, there are other projects like this registry that will permit patients to be easily identified for example, possible trials in the future, no, with new drugs or new treatments. So the next speaker will be Malena Vetterli. Malena Vetterli is a representative of the FMF and Autoinflammatory Diseases Association for patients, and is a member of RIPAG, the union of different associations with in RITA Patients Advocacy Group, to be correct, and she will present the patient's advocate's perspective. I mean, why are we dealing with these webinars, and which is the main goal, also the main objective of our ERN RITA, no? To help patients and for us pediatricians, also their families who are involved in the rare diseases. Malena?
Thank you, Jordi. Well, actually, I'm going to explain more what is RIPAG, how is RIPAG involved in the ERN RITA activities, how do we contribute to the network, and finally also I'm going to talk a little bit about the patient journeys. So what is RIPAG? It was already mentioned by Nico, but anyway, RIPAG is the patient representation within ERN RITA, and there are patient representatives for each stream: PID, autoimmune, autoinflammatory, and pediatric rheumatology. And patient representatives advocate for their disease communities and actively engage in all activities. RITA gives patients a voice through RIPAG. It provides a platform so that patient representatives and clinicians can work together and collaborate on various projects. Next slide, please. Oh, no, it's okay. Okay, you already changed. Okay. Who is involved? Basically, it is patients involved in registered organizations who are interested in improving the quality of life for people suffering with their diseases. By joining RIPAG and contributing to its work, their goals can be more easily achieved. Ideally, we seek patients or caregivers who wish to share their first-hand experience of the challenges faced by rare disease patients. If a patient association wishes to take an active role, they simply need to nominate a representative and apply to RIPAG. Applications can be sent to the email address shown there, and further details on the requirements and application process can be found on the ERN RITA website. Next slide, please. Yeah. How does RIPAG contribute? All RIPAG members are encouraged to participate and share their experiences and perspectives. This information is collected and used to help determine what actions are needed. Within RIPAG, there are patient leads for each disease stream who are part of the RITA Executive Board and participate in regular meetings. The information provided by the patient representatives is presented to the board. RIPAG members are also involved in the ERN RITA working groups and contribute along with clinicians in the development of clinical guidelines, transition care, education, communication, etc. This series of webinars, for example, are the outcome of meaningful collaboration by the education working group. We also have the patient journeys, which is work being done by the communication working group. Next slide, yes. Patient journeys. Well, patient journeys represent, as Nico already mentioned, the entire sequence of events that a patient experiences from the first symptom to a lifelong follow-up. As you may know, early diagnosis and timely access to treatments are essential, not only to avoid irreversible organ damage, but also to improve the patient's quality of life. This exercise is being done for various diseases and includes the symptoms, diagnosis, treatment, follow-up, and aging. There is a lot of work, time, and effort put into this because before a patient journey is finalized, many focus groups in various languages have to be organized so that a consensus can be reached. Once the patient journey for a particular disease has been completed, with input from the patients and the clinicians, it is shared on the ERN RITA website as a visual and educational tool. The patient journeys are a useful resource for patients, their families, non-specialist clinicians, policymakers, and the general public to understand the experiences and needs of those living with a rare condition. Next slide, please. Yeah, this is how the patient journey looks like on the website. And the next slide, shows the symptoms of a patient with CVID. Next. And now we have the final keynotes. If there are any issues patients are aware of, they should bring this information to RIPAG. The work being done uses the information provided by patient representatives to improve the patient journeys and also to incorporate it into the clinical guidelines for the development of future care pathways. Ideally, RIPAG wants to have representation from patients from all over Europe. We're especially interested in more patient organizations from Eastern Europe, but obviously all are welcome. We are all rare, and although some organizations may be very small, but as long as they are registered, they are more than welcome to participate and help bring their voice to a European level. That's it from my side.
Thank you very much, Malena. I mean, it's while we wait for some questions through the platform, I have a few questions for you. Nico, you were talking about the CPMS. For those that are connected and are not related or patient from a center who is member of the ERN RITA, is there any procedure so doctors or their physicians in care in one of our countries inside European Union can have access to the CPMS to discuss with the reference centers of the RITA this patient?
Yeah, of course, we have to be cautious because we are talking about patient stories and we have to be sensitive for their privacy. And what can happen is that if there is a local doctor, that has a problem and that does not know how to diagnose or how to treat, that he or she can contact the help desk. There is the help desk from the CPMS help desk in Prague, Czech Republic, and together with this doctor, we can find a doctor from our team that can indeed access the system and put the data in, and also help finding a team of experts that will read the history and discuss it and come to an advice which is then transferred to the local doctor.
Mm-hmm. Also related with CPMS, we have a question through the panel, is patients would like to know if they can self-refer to CPMS platform, and do they get inputting to the referral to add information about the difficulties they are experiencing, or is this service purely by clinicians?
This is difficult. This is difficult because, of course, we understand the question, and we so far in the past we have indeed helped patients, but we then needed to really discuss that they have been evaluated in their own country by expert teams, and that also this doctor knows about this discussion and is in agreement with the referral system. That's again for the privacy. But indeed, it is possible to discuss cases from patients that are self-reported. But then we really would need a system to involve the local doctor so that we can get all the material that we need for this discussion and to make a proposal for diagnosis and therapy. I hope this is clear.
Trying to explain it or summarizing, if I understood well, is that patients can file or start the procedure, but at the end they need a local, the referral doctor or whatever, who can input all the material, test, labs or whatever in the system.
And we can help. And we can help with that. And of course, there often patients say, well, my doctor will get angry if I tell him that I looked elsewhere. but so far this has not been the case, and the doctors are relieved that we want to help in discussing the cases. And that's a modern time. I mean, patients travel on the net. They Google their diseases, so they're not stupid. So they discuss amongst their peers and also in structures like ERN. So and this is the future, and it's not going to go away. Better get used to it.
I have a question also for Malena. I mean, Malena, one of the issues of this kind of webinars is that maybe we can reach patients that are not involved in one of the associations of RIPAG, no? So what will be your message for them? Maybe through these webinars, or they can contact you and they can work together with their national societies, because it's not that you only have a European perspective with societies representing in all Europe, but also you have contact with different national societies, no?
Yes, I mean, anyone, any patient representative who wants to be involved, even if they are not, if they don't belong to an organization that is in part of RIPAG, they can still collaborate. They just need to contact one of us, obviously, and we can see how we can involve them.
Jordi.
Yes.
Am I allowed to ask a question
of
or
course,
to raise a topic?
I mean, this is a friends, freely group, and every question is very welcome.
Because we have been discussing this topic of patient journeys often with Malena and me, and one of the important aspects of journeys that were now described is also to see how can we translate them in as many languages as possible. Because I mean, here we all talk English, but many people in Europe find this difficult. And Malena, how are your ideas about this? How can we jointly tackle this?
Well, from our side, we have our own translators. So anything that is important that we want patients to know about, we translate it into, I think we do actually in 12 different languages. But this is not it's not being done for RIPAG. It's the organization I represent nationally.
Yeah, and this is a problem, because these documents, these journeys are very, they're lengthy, and therefore translation is very expensive, and we don't know yet how to solve this.
Yeah, we have discussed this in the board, as you know, Nico, and we discussed also for this webinar just before we started, and we are checking how we can have, through artificial intelligence, tools that can translate these recorded webinars once they are done. There are tools that somehow works while they are on live, but probably there are others, and we have to check them, that automatically can translate already recorded webinars. So because we know that not all patients are available or have the knowledge enough to follow an English webinar, and we want to be as much as accessible possible, so we will check if we have these at least webinars translated to different languages. And we have more questions. We have also a question about the registry. What is the procedure to get access to the RITA registry? How safe are the data? I think it is a question for you, Nico.
Yeah, how safe are
the data? How, I mean, I understand protection of the...
Well, of course, the data are anonymous, and they are being collected in a data system, Castor, which is ESO certified. So the whole system is being evaluated by an IRB. And don't forget, the RITA registry does not contain sensitive medical data, clinical data. It just says, are you male or female? What is the date of, not the date of birth, but the year of birth? What is the ORFA code for the diagnosis? And where are you treated? The access to these data is only for the HCPs, so for the doctors. And this is all because of, privacy. If then there is a question, a research question, for instance, about FMF, and we say, okay, to address this question, we need 500 patients with this disorder, and ask them to contribute. We know where the doctors are that treat those patients. So we can say, okay, pass on this request to your patients. Please ask your patient whether they want to collaborate. So this is how it will work.
We have another question. I mean, maybe you or Alessandra, who is leading one of the groups. What working groups are in the ERN RITA? The working groups.
Alessandra, maybe you can, yeah?
Yeah, sure. Actually, the organization of a ERN RITA includes working groups, and this is very, very important for leading different subjects, researches, and projects. More specifically, a very, very good example of a working group is the working group on education, chaired by Jordi, which is very active and very efficacious in providing this kind of activities. Other groups include the research working group, guidelines working group, molecular testing working groups, and all these different groups actually have the peculiarity to be transversal within the different 4 branches, because as we mentioned, actually compared to other ERNs, I would say RITA has this very interest, peculiarity, and also which is also a challenge actually, to include different branches that used to work in a more separate way, in a more independent way. So the working groups, actually this is a very important question, because working groups play a major role in the interaction between the different branches and providing guidelines, webinars, projects that are really crossing through the 4 branches. So it's a fundamental area, fundamental work. Absolutely. Yeah. I don't know, Nico, if you want to add something about this.
No, it's very well said. And I just wanted to add that if there are patients who are thinking, well, what's exactly happening? Can I contribute? Please contact the coordinating team, especially Alessandra. We can discuss and we can see how you can help the working group, because really we want to make the working groups active, lively, and composed of many different countries and patients and doctors simultaneously.
And to give patients a voice. That's the key of the message. Just a last question, Nico. Is there any kind of collaboration with different European reference networks? Because sometimes patients they don't have just one disease, they can have one with complications, have several diseases involved. How the different European reference networks collaborate?
Yes, well, we should make an make an overview of disease groups that are being that are present in various different ERNs. Often diseases are complex and have multi-morbidity. So it can happen that for your eye problem, you go to an eye ERN. when you have also a knee, you go to a knee problem. So to a knee ERN, and this should not be leading to fragmentation. So the ERNs should discuss with themselves how to collaborate, and therefore we are making a method of understanding of collaboration. We will collaborate, for instance, about transition of care with Reconnect. With patients with lupus who have renal problems, we will discuss with ERCnet. So there are many potential collaborations possible.
Thank you very much. I think it has been a nice starter for this webinar, Patients Center series. Malena, if you want to say something to conclude.
No, just what I already said, that if anyone, any patients, if they feel that they have something to share, to communicate, just contact us or the network, and we'll see how to, I guess, incorporate their ideas into the work we do.
Thank you very much.
We will try to keep up the websites, the RITA website, with as much possible information. We will expand also this information that Malena is referring.
For all of us who are following or who will see this video recording, remember that you can access through the ERN RITA website, which is easily found if you Google the name, and there you can have all this information, all the webinars, and you can easily reach any question you have. I would like to thank the speakers today for the kindness to be here and to introduce ERN RITA, especially Malena, for also presenting the RIPAG perspective and helping to co-chair this session. And we'll invite you to follow us every third Wednesday of months between 6 to 7 p.m. Central European Time. Thank you to everybody. Have a good night.
Thank you.
Thank you. Thanks.